Okay, this is the second part of this video, and as I promised, I was going to show you, I was actually going to give you, in the link, in the description of this video, I was going to give you a link to the video that I was referencing in regards to that medical doctor, but when I went online, this is what I found, right here. As you can see, YouTube has taken the video down. I find that really interesting. The doctor did not say anything that was hostile or that disputed, you know, basically telling people necessarily not to get vaccinated. He just was essentially stating the facts as he saw them, as he was able to find them, and of course looking at it through the lenses of his expertise as an immunologist and a virologist. I didn't really get the impression that he was saying anything inflammatory, but yet YouTube finds it in its will to take the video down. I think that shows poor taste on their part, but you know, that's just my opinion. Very strange that they would do that, but then again, not so strange. I've been hearing a lot about that kind of stuff. So, without further ado, I'm going to go ahead and show you some of the research that I have been able to find. I did not, however, find the specific article that he was referring to that stated that a vitamin D level of 55 nanograms per deciliter or above has the most protective effect. But I did find something that was very, very close. And so I'm going to take you to this article right here, Immunologic Effects of Vitamin D on Human Health and Disease. This was, let me see here, what was the date of this article? July 2020. That's pretty recent. And so basically in here they talk about how, about the clinical trials and let me see here. Interestingly, recent evidence suggests that some individuals might benefit from vitamin D more or less than others, as high individual difference in broad gene expression in human peripheral blood mononuclear cells in response to vitamin D supplementation has been observed. Although it's still debatable what level of serum 25-hydroxy vitamin D is optimal, that's just another way of saying vitamin D, that's what you take supplementally. Is it advisable to increase vitamin D intake and have sensible sunlight exposure to maintain serum hydroxyvitamin D at least 30 nanograms per milliliter, and preferably at 40 to 60 nanograms per milliliter to achieve optimal overall health benefit of vitamin D. The only thing I didn't like about this article, under the conflict of interest statement, oh no, I'm sorry. This one's good. There's no conflict of interest. This was, they were actually being very objective in this particular one. There's another one though. They say similar things right here. Okay, so this one was actually where they were talking about like how much they supplemented in order to address vitamin D deficiency and to help with mitigating, to reduce risk of respiratory tract infections with influenza, COVID-19, and other respiratory infections and inflammatory conditions. Through several mechanisms, vitamin D can reduce risk of infections. Those mechanisms include inducing cathelicidins and defensins that can lower viral replication rates and reduce concentrations of pro-inflammatory cytokines that produce inflammation that injures the lining of the lungs, leading to pneumonia, as well as increasing concentrations of anti-inflammatory cytokines. So, pro-inflammatory cytokines are chemicals that your immune system uses to combat infections and other cellular damage. So these inflammatory cytokines are released in response to infectious agents like viruses such as coronavirus, SARS coronavirus 2, influenza, HIV, etc. Right? It releases the inflammatory chemicals. They're like chemical warfare agents. I always liken them to mustard gas or napalm. Like they just burn, and they burn everything. They scorch earth. And while they're beneficial for containing and destroying an infection, they can wreak havoc on the host, i.e. the person that's infected. And that's what's happening with some of these coronavirus patients. They get this infection, and their immune systems aren't very stable. They're what we in the functional medicine world we call it hyperbelligerency. Okay, it's just a fancy way of saying that the immune system is over responsive. It's just has a hyperactive ability about it. And so when something comes in that it perceives as a threat, rather than having like a normal controlled immune response, these people's immune systems go haywire. They go crazy, and it's like blitzkrieg. And unfortunately, the individual ends up suffering the effects of that. The person gets a lung full of fluid and a ton of inflammation, and essentially some of them end up passing away because of it. So what they're talking about here is that vitamin D actually mitigates that, like reduces it, and it even helps to prevent the virus from being able to infect the individual. Now this particular study right here, this is what I was mentioning a moment ago. Conflict of interest statement. I didn't like about it. What I didn't like is that this supplement company, of course, was running the study, so it can make it look like, okay, it's in their best interest to say, hey, you take vitamin D, you're going to be less likely to get infected. But the cool thing is, this other study that I showed you says a similar thing about the 40 to 60 nanograms per milliliter as this one does right here, right? So no conflict of interest. So we've got two studies from each end of the spectrum that kind of say the same thing. This one just goes more into detail about what vitamin D does for you, right? Now I want to show you how vitamin D works, okay? So, this right here shows you how vitamin D actually induces certain immune cells, CD8 cells, which are they're destructive cells that they get in and they mitigate infections, right? Introduction of antimicrobial peptides. They mentioned these cathelicidins in that other article. They're showing how that ties into fighting and preventing influenza infection, H1N1, blocking viral entry and replication. They show this with HIV and of course with other induction of autophagy, apoptosis. Okay, autophagy is basically your immune cells go in and they consume cells that are infected, right? That's autophagy. Apoptosis is actually inducing a cell to kill itself. So you can kind of think about it almost like kamikaze. The cell is killing itself to save everything else, right? Sometimes you want that in the case of an infection. Other immune regulation, suppressing TLRs, I don't remember what those are. This one has to do with dengue fever, which is another very serious viral infection. And let's go over, okay, this shows you how vitamin D, low vitamin D ties into poor homeostasis, which is kind of actually has been linked to people developing systemic lupus, multiple sclerosis, and other autoimmune diseases, and increased susceptibility to infections like influenza, dengue, coronavirus. And they even kind of come down here and they talk about the neurotrophin dysfunction, which they're linking to the somatosensory defect of loss of smell in coronavirus patients. I'm seeing this more and more with people who have gotten the infection. I know patients that still don't have their sense of smell, and some of them don't have a sense of taste still from after being infected with this thing. So it does cause damage, and it's a very real disease, but again, it's not like there are things you can't do to mitigate the risk of it. Coming over to this one, we see how, we can see how zinc, I mentioned about taking zinc in the first part of this video. Zinc helps natural killer cells and T defense cells to deal with infectious agents. It actually helps with unraveling viruses. It's called viral uncoating. What you're doing is you're actually pulling the shell off of the virus and just letting the RNA or the DNA spill out so the body can attack it and destroy it, which of course affects the virus's ability to replicate. Omega-3 is tied into cytokine modulation. It helps the body produce anti-inflammatory cytokines, because you've got inflammatory ones and you have anti-inflammatory ones. And so omega-3s help the body produce more of the anti-inflammatory kind, which again is going to help to diminish the inflammatory immune response. It's going to help the host not destroy itself, so to speak. And let's see here. So there. I liked this diagram because it shows how, here you have the SARS-CoV virus 2 version 2, or coronavirus version 2. It shows that it triggers the macrophage that goes and releases these interleukins and tumor necrosis factor, triggers certain reactions in the alveoli in the lungs, causes cellular death, can trigger a cytokine storm, leads to vasculitis, which triggers leakage in the blood vessels, which just spills out into the lungs. Essentially, like a person that develops a bad enough inflammatory effect from this thing, they're literally kind of drowning their own fluids. Or what they do is they kind of create a cesspool that other opportunistic bacteria, like the pneumonia bacteria, can feed in and replicate in, and the people end up dying from pneumonia, right? Most of the time, honestly. Over here, vitamin D, an immunomodulator, and it shows how vitamin D affects gene expression. It augments your innate immune response. Innate immunity it's the immunity you're born with, all right? And then if you don't have enough vitamin D, you have lowered acquired immune response. So acquired immunity is when you come across a pathogen and your immune system learns to recognize it and keeps it in its memory, and usually you create something called antibodies. So low vitamin D status affects your acquired immunity, and it affects your innate immunity, right? So and here's kind of all the things that's tied into, and it's somewhat complicated, but you can find this stuff online if you really want to get into it. So I just want you to see how there's a lot of research out there on these things, been done for years, and the reality is that viruses have been around since the dawn of time. They're not going away. If we didn't have coronavirus, we'd have something else. And not to say to blow it off, but there are things you can do to mitigate your risk of getting infected by any viral infection, including coronavirus. And the research here is suggesting that a higher vitamin D status, they're saying somewhere between 40 to 60 nanograms per deciliter, which is how you measure it on the blood test. The guy I was telling you about earlier in the video, he was saying like 55 and above was the research he was quoting. So, like I was telling you before, in functional medicine, the range we're looking for is somewhere between 50 and 80 nanograms per deciliter. I usually shoot for about 65 to 70 is about the number that I try to aim for. Easiest thing to do is measure it, get a blood test for vitamin D, see what your levels are, and if they are low, initiate a course of vitamin D therapy on yourself. Depending on how low they are, you can start out. There's actually an article in here talking about, let me see here, let me find it for you. They talk about taking 10,000 IUs of vitamin D for a few weeks to rapidly raise your concentrations, and then follow it up with about 5,000 IUs per day after that. So start out with about 10,000 IUs per day for a few weeks. I'd say probably about 4 weeks is usually kind of the standard there. It's kind of the protocol that I follow. And then after that, you follow it up with 5,000 IUs a day. But I recommend you run your vitamin D levels, see where they are, and then from there, if they are low, i.e., if they're below the 40 to 60 nanograms per milliliter, then you can start out with that 10,000 IUs per day for about 3 to 4 weeks, and then go to 5,000. And I would suggest running your vitamin D levels after about a month of doing that protocol, right? Be on the protocol for about a month, run those levels again, see where they are. If they're adequate, then maybe stay at the 5,000. If they're not, continue 5,000 or even go back to the 10,000, and then run them again in another month. If you don't want to do that, wait 2 months, right? You can go, I wouldn't go any longer than 3 months. Like, do it within 3 months. But you know, again, it depends on how objective you want to be about this. I recommend it about once a month until you got your levels where you need to be, and then from there either run it quarterly or run it semi-annually. All right. Anyway, thanks for checking this out, and I'll be releasing more content very soon. This is Dr. Robert Shapiro with Shapiro Holistic Health and Chiropractic in Stockton, California.